A pleasant day everyone, we are Group 3 Block D and we will be presenting our concept map on Otitis External. The following legends are red box for disease condition, yellow for predisposing factors, pink for precipitating factors, gray for disease process, purple for signs and symptoms, dark brown for nursing diagnosis, light brown for healthcare management, dark orange for diagnostic tests, green for nursing interventions, bold line for then or next, and dotted line for or connecting to signs and symptoms. Otitis external is an inflammation or infection of the external auditory canal, the auricle, or both. It causes inflammation or redness and swelling of the external ear canal, which is the tube between the outer ear and eardrum. Otitis external is often referred to as swimmer's ear because repeated exposure to water can make the ear canal more vulnerable to inflammation. This condition can be found in all age groups. The predisposing factors are more common in women: family history of ear infections, secondary smoking, air pollution can increase the risk of respiratory infections, which therefore increases the chance of ear infections. Heredity, commonly seen in people with Alaskan heritage. Chronic conditions such as eczema, asthma, and allergic rhinitis. And lastly, age. Children are more commonly affected. It can be attributed to their immune system not being fully developed. While the precipitating factors are acute diffuse external otitis, which is usually caused by bacteria such as Pseudomonas aeruginosa, Proteus vulgaris, Staphylococcus aureus, or Escherichia coli. Fungal external otitis, typically caused by Aspergillus niger or Candida albicans, is less common. Damage to the ear canal as a result of excessive scratching, the use of cotton ear swabs, or long-term use of earbuds, for example, may increase the risk of otitis external. And skin conditions. In addition to seborrheic dermatitis, skin conditions such as acne, eczema, or psoriasis can make otitis external more likely. Otitis external refers to an inflammation or infection of the external auditory canal, the auricle, or both. The inflammatory response is believed to be caused by a disruption of the normal pH and protective factors within the auditory canal. This includes a sequential process of damage to the epithelium, loss of protective wax, and accumulation of moisture that leads to a higher pH and bacterial growth. As a result, the inflammation causes ear pain, itchiness in the ear canal, discharge of liquid or pus from the ear, and some degree of temporary hearing loss.
Signs and symptoms. For mild signs and symptoms, it includes itching in your ear canal, slight redness inside your ear, mild discomfort that's made worse by pulling on your pinna or pushing on your tragus of your ear, and some drainage of clear odorless fluid. For moderate progression, it includes more intense itching, increasing pain, more extensive redness in your ear, excessive fluid drainage, feeling of fullness inside your ear, and partial blockage of your ear canal by swelling, fluid, and debris, and lastly, decreased or muffled hearing. The signs and symptoms for advanced progression include severe pain that might radiate to your face, neck, or side of your head, complete blockage of your ear canal, redness or swelling of your outer ear, swelling in the lymph nodes of your neck, and fever. For the nursing diagnosis, we have acute pain, disturbed sensory perception, auditory, deficient knowledge, and risk for infection.
The healthcare management, otitis externa and otitis media are often treated differently. Drops that carry antibiotics straight to the affected skin of the external ear are employed. Administering a non-ototoxic antibiotic, otic drop based on afloxacin such as ciprofloxacin or afloxacin when the state of the eardrum is unknown. Ophthalmic drops containing tobramycin have also been used for this purpose. If the eardrum is intact, there are several alternative eardrops that can be employed. Cortisporin otic suspension is also a low-cost and typically successful treatment option in this circumstance. Sometimes, a wick is placed to deliver the antibiotics deeper into the ear canal. Local pain medications may be also used. Resistant bacteria or fungi can develop refractory otitis externa, and in this case, antifungals or Burow's solution are commonly employed. Burow's solution is occasionally injected directly into the middle ear. Because of the predominance of uncommon organisms, those who are immunocompromised or have diabetes are typically treated more aggressively with a mix of antibiotic drops and systemic antibiotics. Fungal infections are more frequent in this population, and treatment may include the use of an antifungal medication. For chronic otitis externa, medical treatment generally includes steroids, antibiotics, and cleaning. Eventually, surgery to widen the ear canal may be required.
Now, let us proceed with diagnostic tests or exams. First we have here is pneumatic otoscopy. The doctor uses a tool called a pneumatic otoscope to look at the eardrum for signs of an ear infection or fluid buildup. Next we have is tympanometry. It measures how the eardrum responds to a change of air pressure inside the ear. Then we have ear culture. This test checks for germs that can cause infection. The sample taken for this test can contain fluid, pus, wax, or blood from the ear. We also have a diagnostic test called microscopy of exudate or debris from ear canal. Also, we have CT scan of the temporal bone with intravenous contrast. Next, we have MRI of the brain and internal auditory canals with and without gadolinium. Magnetic resonance imaging or MRI of the internal auditory canal is a non-invasive, painless diagnostic imaging procedure that uses using radio waves and a strong magnetic field to create detailed images of the bony canal that transmits nerves and blood vessels from the base of the brain to the inner ear. In addition, we also have tympanocentesis. This test can remove fluid if it has stayed behind the eardrum, such as chronic otitis media with effusion, or if infection continues even with antibiotics. Next, we have blood tests. These are done if there are signs of immune problems. Then lastly, we have hearing tests. These tests are recommended for children who have had fluid in one or both ears or otitis media with infusion for a total of 3 months. The test may be done sooner if hearing loss is suspected. Now, proceeding to our nursing interventions, first we have to assess client's description and frequency of pain. Use the pain rating scale. Then, we have to monitor and record vital signs closely. Next is to administer pain medication such as acetaminophen or ibuprofen as prescribed. Next, it's important to monitor patient for relief of pain and any side effects of medication. Reassure patient that the discomfort usually subsides within a day on antibiotics, but re-instruct the importance of compliance with the whole prescription. Lastly, instruct the use of a warm heating pad or an ice pack application. Thank you for listening. We hope that you learned something from our presentation.